Tonight, we're going to talk about BVD, or bovine viral diarrhea, including what it does inside cattle, how persistently infected animals develop, how veterinarians distinguish it from other diseases, and how it can be prevented. BVD is caused by bovine viral diarrhea virus, an RNA pestivirus. Despite its name, BVD does not always cause diarrhea. Infected cattle may develop fever, depression, decreased appetite, reduced milk production, respiratory disease, oral erosions, diarrhea, reproductive failure, abortion, congenital abnormalities, or the birth of weak calves. Some infections produce no obvious signs at all. After entering a susceptible animal, the virus replicates in white blood cells and lymphoid tissues. This may cause leukopenia, lymphoid depletion, and immunosuppression, leaving the animal more vulnerable to secondary respiratory and intestinal infections. BVD is especially damaging during pregnancy because the virus can cross the placenta. Infection early in gestation may cause infertility, embryonic death, or abortion. If a fetus is infected with a non-cytopathic strain during approximately the first 40 to 125 days of gestation, before its immune system can recognize the virus as foreign, it may survive as a persistently infected calf. The calf becomes immunotolerant to that specific virus and remains infected for life. Persistently infected cattle continuously release large amounts of virus through saliva, nasal secretions, urine, feces, semen, and other bodily fluids. Some are undersized, weak, or frequently sick, but others appear completely healthy. This means a normal-looking animal can silently infect pregnant cattle and create additional persistently infected calves. A persistently infected animal may later develop mucosal disease if its original non-cytopathic virus changes into a cytopathic form, or if the animal encounters a closely related cytopathic virus. Mucosal disease can cause fever, extensive erosions in the mouth and digestive tract, profuse diarrhea, dehydration, rapid weight loss, and death. BVD cannot be reliably diagnosed from clinical signs alone because diarrhea, fever, respiratory disease, infertility, and oral lesions occur with many other conditions. Veterinarians consider the animal's age, pregnancy history, vaccination history, herd pattern, laboratory findings, and the specific organs affected. For example, salmonellosis commonly produces fever, septicemia, and acute diarrhea and is investigated using fecal culture or PCR. Coccidiosis more commonly affects younger cattle and may cause bloody diarrhea and straining, with diagnosis supported by fecal testing. Winter dysentery typically spreads rapidly through adult cattle, producing high herd morbidity but relatively low mortality, and bovine coronavirus PCR can help confirm it. John's disease usually causes gradual weight loss and chronic diarrhea in older cattle and is investigated using fecal PCR, culture, or serology. Malignant catarrhal fever may also cause oral erosions, but severe eye inflammation, corneal opacity, enlarged lymph nodes, and PCR results help distinguish it from BVD. To identify BVD, laboratories can use PCR, antigen capture ELISA, virus isolation, immunohistochemistry, or paired blood samples showing an increasing antibody response. Ear-notch antigen testing, immunohistochemistry, and PCR are commonly used to find persistently infected cattle. A positive result does not always prove persistent infection because an animal with a temporary acute infection may also test positive. A second sample is therefore collected after an appropriate interval, often around 3 weeks, depending on the tests being used, to determine whether the animal remains positive. Persistently infected cattle remain virus positive, while temporarily infected cattle usually clear the virus. There is no antiviral medication or injection that eliminates BVD virus from a persistently infected animal. Treatment of acutely sick cattle is supportive and may include fluids, electrolyte correction, nutritional support, and treatment of confirmed secondary bacterial infections. Antibiotics may treat a secondary bacterial infection, but they do not kill BVD virus. Prevention centers on protecting pregnancies and stopping persistently infected cattle from entering or remaining in the herd. New animals should be quarantined and tested before introduction. Calves, replacement heifers, breeding bulls, and the dams of persistently infected calves may also require testing. Confirmed persistently infected cattle must be permanently removed and prevented from contacting other cattle, especially pregnant animals. Vaccination is another major part of control. One example is Bovishield Gold FP5, an injectable modified live vaccine containing attenuated BVD virus strains. The weakened viruses undergo limited replication in an appropriately vaccinated animal, exposing the immune system to viral antigens and stimulating neutralizing antibodies, cellular immune responses, and immune memory. This helps the cow control later exposure before the virus produces significant viremia or crosses the placenta, reducing the risk of fetal infection and persistently infected calves. The vaccine cannot cure a persistently infected animal and does not replace testing or biosecurity. Modified live vaccines must also be administered according to their labels. Some may be used in pregnant cattle only when those animals were properly vaccinated before breeding and within the required previous period. Incorrect use may create a risk of reproductive complications, so a veterinarian should design the vaccination program around pregnancy status, age, previous vaccination, herd exposure, and product labeling. The most important lesson is that BVD control requires vaccination, biosecurity, reproductive monitoring, laboratory testing, and the rapid identification and removal of persistently infected cattle. Clinical signs may raise suspicion, but laboratory testing is what separates BVD from the many respiratory, reproductive, and intestinal diseases that can look similar. If you have topics you would like us to make content on next, or would like to donate to our video or game development, reach out to us at doggersgame or dogtoursgame@gmail.com.